The meeting for the Council on Aging for November 6th is now open. Please stand, if you're able to, for the Pledge of Allegiance. Nick, please lead us.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Francine, if you would please call the roll.
Please say here present. When your name is called, Commissioner Allen. Commissioner Fotheringham.
Present.
Commissioner Gorbach. Present. Commissioner Grimm.
I'm here.
Commissioner Healy. Here. Commissioner Kopaz.
Here.
Commissioner Loomis.
Here.
Commissioner Norkin.
Here.
Commissioner Shentas. Yeah. Thank you.
Very good. Everybody's here and we're ready to roll. Item 4 on the agenda is public comments. A speaker card is available for those wishing to address the Council on Aging regarding items on the agenda on a subject regarding senior services. Speakers are requested to state name and city of residence for the record. People who have presented cards will be allowed 3 minutes, and then we'll throw up a yellow card to let you know you got to start slowing down. So we have two folks, Cynthia Bankston, representing the Global Adult Commission. Cynthia, the microphone's yours.
Good afternoon, and thank you very much. My name is Cynthia Bengtson, and I live in Newbury Park. I'm here from the Global Senior Center Commission as a commissioner. We are excited to present to you the latest of our History Comes Alive series. It's going to be on November 17th at 2 o'clock in the afternoon. That's a Sunday afternoon at the Global Adult Community Center. Our series includes history of the Conejo Valley, which we have had 2 on so far, with reenactments by members of the Stagecoach Inn Museum talking about the history. This history is the pictorial history by Ed Lawrence, who has photographed pictures from the Conejo Valley for years and years and years. He will take you on a journey from the early days to the later days. We are excited also this time because he's going to bring along some friends who have lived in the area for a long time to share their stories of living in the Conejo Valley. We are having 2 other programs in our History Comes Alive series. Those will be later in the year and into 2014. So follow up with us, and I hope you can come and enjoy this wonderful afternoon with us. Thank you very much.
Thank you for joining us, Cynthia, and I'm glad you are promoting this, and hopefully you'll be well attended.
Thank you.
Thank you. Our next is a very familiar face, but always coming up with new ideas. Brenda Birdwell, representing Senior Concerns and some of their activities.
Good afternoon. My name is Brenda Birdwell, and I live in Thousand Oaks. I'm a senior advocate for Senior Concerns. I share an office with our featured speaker here today, Betty Berry. My office is at the Global Adult Community Center at 1385 East Jans Road. Our telephone number is 805-495-6250, and the number for our Houghton Camp address, which is where our adult day is housed, is 805-497-0189. Everything that I'm going to be talking about can be found on our website. That's www.seniorconcerns.org. And all of these things also appear in Betty Berry's weekly column on Wednesday in the Ventura County Star. The first thing that I'm excited to remind those of you who don't know about it and to tell the ones who do is Boomer Boot Camp. It's our second year of edutainment. That's entertainment. That's also educational. The series starts tonight, right here, right across the hall in the outside the parking lot. The series is normally $60 for 3 sessions. I have tickets here today that I can sell you for $30 for the whole series of 3, and 1 session is $25. So it's quite a good value. The first speaker tonight is David Baxter, who comes from Ken Dykewald's New Age. The second series is David Solie, who wrote the book How to Say It to Seniors. And the third one is The third one is Carolyn Orsborn, and it's going to be emceed by Mary Olson of Cal Lutheran, KCLW. The other thing that I wanted to tell you about is it's Medicare open enrollment, everyone's favorite time of the year. It's when Betty and I sit back and eat bonbons. This year, during open enrollment, which is October 15th to December 7th, in less than 60 days, the Ventura County HICAP office helped over 3,000 people. So it's a very, very busy time for us. Betty's going to be presenting her Medicare 2014 today. She's going to do an encore next Wednesday at the Westlake Village Civic Center at 1:30. That street address is 31200 East Oak Crest. So that is November the 13th. On Saturday, November the 16th, we're having a memory screening day at our Adult Day Center at 401 Hodenkamp. This is a great way to come and see if you think maybe you're getting a little bit more forgetful or if you just want some reassurance. There's private screenings. There's also going to be presentations by Dr. Lisa Hayden about normal aging versus problems with the brain, and T-Bar is going to talk about brain fitness. And last but not least, on November 22nd from 9 to noon, at the SCAN offices in Ventura, they're going to have an encore session of MedChat. I participated in this last one. It actually gives you an opportunity to give the decision makers in Washington, D.C. about Medicare services your opinion about what's working and what's not working with Medicare. Again, my name is Brenda Birdwell, 805-495-6250. Thank you.
No, Brenda, don't run away. What was that last thing?
It's called MedChat.
Is this something new, or?
It is new. There was an original session in Ventura, and what you do is there's a computer program. It's kind of like playing the game of life. There's a computer program, and the first time around you go through, it's got different parts of Medicare, assigns different points to the parts. So you go in the first time, and you move things around based on what you think should or shouldn't be covered for yourself. Then they have a questionnaire that throws a question out to you that, say, for example, you say you don't think if you have a broken arm, you should be able to go to the emergency room. You should have to go to urgent care instead. Then you get something that would say how it would impact you personally. So it makes it real life. Then the second time around, you do the same exercise with a group of 2 people. So you have to have consensus as 3 people. And then you do a final time with the entire group. Everybody has to come to consensus. And the final session is actually videotaped, and real decision makers in Washington, D.C. are asking for the information and listening to the input. It's amazing.
Yeah, that's quite unusual. I've never heard of a program like that.
Yeah, it's going to be going on, I think, for 3 years. The first session in Ventura at SCAN was about 3 months ago.
And whereabouts is this? It's going to be a government center?
It's at the SCAN. The SCAN has new offices on Partridge
SCAN.
Street. They just moved down the street from where they were. And there's only room for 12 people. So if you're interested and you see, it's going to be in Betty's column next Wednesday. Yeah. And if we had a waiting list, this is an encore one. So if we had a waiting list, we could probably get them to do additional sessions.
Huh.
Great opportunity.
Oh, thank you. That's pretty interesting. All right. Okay. Thank you again. A good friend of ours, as Senior Concerns is. So that concludes public comments, folks. But just want to have you understand that anytime you have an issue, you want something to be publicized, and for the senior community, please, this is your forum. It doesn't take much to fill in these cards, quite honestly. So come on up if you have questions or you have things you want to discuss about the senior community. All right, we'll move on to this next item, and our Miss Photogenic over here. Francine is going to run through a little bit of almost a tutorial on the TO City website. Just can I get an idea? Have any of you folks used the TO website? All right, well, okay. Hopefully it keeps growing, but we want to introduce you to this, particularly from the senior standpoint. Although I think this, Francine's going to break it down into several different packets as you wish. And she's going to go talk about some of the introductory aspects of it to it now. All yours, Francine. Thank you.
Thanks, Dave. Good afternoon, Commissioners. Dave's asked me to spend a couple of minutes each meeting highlighting some of the things from the city's website and how to get to it. So today, there's a lot on our city's website. So today, what I thought I would do is just go over, highlight some things on our homepage. So to get to the homepage, for a start, you need to type in www.T for thousand, oaks.org in your address bar on your internet browser. So it's www.toaks.org. And this is what you'll see now. This is your city's homepage. So from the top bar, you can get to almost anything you want. So under residents, you can find everything from bike safety to volunteer opportunities. And some of the big things that I like to highlight are the Thousand Oaks transit system and scroll down a little bit, and senior services. So from the senior services page, you can find links to ConeoConnections.org. You can find meeting agendas. You can find out who our guest speakers are at these meetings. There's a lot of things that you can find out through here. But you have your transit, and you can also sign up to be notified about services or events in our community. Under our business tab, this is really for businesses, so it's a little bit about economic development, some of our business programs, and businesses can find out about licenses and things like that. Under government, you can come to committee, commissions, and boards, and we have quite a few community commissions and boards, and you can find all their agendas and everything. You can find out about city council. You can even go to our municipal code online and look up any of the laws, and you can go and visit any of our departments and see who's in there. Our online services, you can do, you can pay your bills, you can request city assistance, you can watch TOTV videos, which are fabulous. If you haven't watched some of our old videos, some of them are really amazing. You can also take a look at Ventura County Alert, which is an alert system for emergencies in our community. You can sign up through there. On the Civic Arts Plaza, you can find anything that's going on in our 2 theaters, and you can buy tickets from here. Library has some amazing programs on a regular basis. Right now they have One City, One Book, and you can look up anything in the library calendar. You can, search our collection. You can reserve a book and they'll hold it for you. You can do all kinds of things there. Under contacts, there's a thing called frequently requested numbers, and if you click on that, that's your main numbers, reporting graffiti, reporting code compliance issues, or anything like that. You can find under frequently requested numbers. So on the left bar, you have a search engine, and then these buttons over here are really some of the main things that people go to. Those are the pages that are most frequent, so they wind up being buttons on the left. The big area in the center here where you see the pictures, this is, 6 or 7 of one of the top things that are affecting our communities, top stories affecting our community. And then if you scroll down a little bit on the page, you'll see these big buttons here, and there's actually 8 of them. So if you click on the arrow to the right or the left, it will take you to more. The one thing that I wanted to talk about that is near and dear to Dave's heart is the calendar. And when you click on the calendar, it'll take you to today, and it'll show you all the things that anyone has posted about today. And the Ed Lawrence thing should be on here. So if it's not, check it out. And you should email it to me so we can add it. But these are really great events in our community that are coming on. But like our Council on Aging meeting is on there. The Boomer Boot Camp that Brenda talked about is on here. And so next meeting, we're going to go into the calendar a little bit deeper, and I can show you how it can benefit your agencies or how you as an individual can find out really cool things to do. So we will do that next time, but between now and next time, feel free to go to the website and take a look at anything, and you can send me questions, and the questions can be sent to councilonaging@toaks.org. And that's it. Thanks, Dave.
Oh, that's great. Good start. Thank you, Francine. This is a very robust website. It really is. I mean, I've looked at some other cities, other government, and this really has a lot of information that we as neighbors, you just sort of get rejuvenated when you see all the things that are going on, all the things that are offered in this city that I think people should better appreciate and take advantage of. I mean, it is amazing to go back or to just go through some of the lists, look at what's going on in the calendar. So I just want to second what Francine said. Get into the website, even if you just go in there once a week. It's just refreshing to see what's going on in this wonderful community. All right, that should do it. Thanks again, Francine. I'd like to turn it over now to Lynn with regard to the liaison reports. Lynn?
Thank you very much. I will repeat again that not only does the Council on Aging have an advisory capacity to the City Council with respect to affairs that concern seniors, we also have liaison with various commissions and associations in the county. And Commissioner Shentis will begin us with item 6A, the Caneo Senior and Volunteer Program. Go ahead, Marty.
Thanks, Len. What I'm going to tell you about is what's going on with the Caneo Senior Volunteer Program. Right now, they are, from now until November the 15th, the CSVP Boutique has this wonderful holiday sale. Come find everything you need, from ornaments to high-quality gifts at unbelievable prices. Our extensive greeting and card selection now has an amazing holiday section now. The CSVP holds a recognition luncheon every year to reward those volunteers who have put in 150 hours of service to our community. It's going to be held on December the 3rd and 4th at the North Ranch Country Club. And and this year we have 550 volunteers who have qualified. In other words, they have put in over 150 hours in the year. The CSVP Meet and Greet Luncheon on October the 24th was a brilliant success. We greatly enjoyed the opportunity to meet face-to-face with our community and partners and hear about their agency volunteer needs. It was also great to see the members from different agencies meeting and mixing and making connections with each other. We would like to thank everyone involved for making the event a success and for supporting the effort to coordinate our contributions to the wonderful Caneo community. Thanks, Lynn.
Thank you very much, Marty. Let's go to item 6B and the Global Adult Community Center. And Harry, you have a couple of things to tell us, I think.
Thank you, Len. Good afternoon, and thank you all for coming to our broadcast or watching us at home. First, you may or may not have heard that as of Friday, November 1st, Andrea Koval resigned her position.
Can you put the mic a little closer?
Resigned her position at the Global Senior Adult Center and to pursue other avenues in her career. She has been replaced by Patty Ham, who has been recreation leader at the Borchard Community Facility. We hope to introduce Patty at on our December program. Let's get on to what's doing at the Global Center. The short answer is that about everything. Besides the ongoing classes in technology and writing, fitness, cooking, singing, dancing, painting, quilting, support groups, discussion groups, and services, there are many special programs such as driver safety, fundraising with Ralph's and Mana, to name a few. Global offers many travel experiences, both local and foreign, from one-day trips to two-week excursions to almost any place in the world. For more details, I would suggest you get a copy of the Global Gazette, published monthly, and also available online at www.crpd.org/GSAC. Here are some highlights of programs which should be of interest to most of the folks who use the Global Center. On Tuesday, November 18th, from 3 to 5 p.m., there will be a workshop on legal documents that may save time, money, and unnecessary court costs by proactive legal planning. Each attendee will receive a life bookbinder. On Tuesday, November 19th at 6 p.m., there will be a presentation by financial experts on how to get more potential income, pay less in fees, and make your money work harder for you. On Wednesday, November 20th, from 12:30 to 1:30 p.m., UCLA Health Dr. Natalie Edmondson will explore the many causes of hoarseness, important symptoms to know, and current available treatments. Thursday, November 21st at 5:30 p.m., will present Reaching Retirement. Now what? The program will include learning to plan carefully, invest wisely, and spend thoughtfully. Reservations are required for all of the above programs. To make a reservation, please call 805-381-2744. Besides the above, the Rotary Club of Westlake is sponsoring an annual holiday breakfast on Friday, December 13th from 7 a.m. to 9 a.m. Reservations are required and will be taken starting November 11th. Also, 805-381-2744. A holiday party is planned for Monday, December 9th from 1 to 3 p.m., sponsored by the CRPD and the Global Center Commission. Pick up your tickets, 2 max, for each person at the front desk of the Global Center starting November 18th. Now on to another item. The Global Senior Center Commission is currently a group of 11 seniors, and were chartered by the Caneo Recreation and Park District to assist the staff at Global Center in enhancing the experiences of the users of the center. To that end, the Commission raises funds to support programs and purchase equipment as needed. The Commission runs the center's very popular bingo games on Tuesdays, Fridays, and Saturdays. All the help the bingo games are the Commissioners and other volunteers. Every dime raised goes toward the benefit of the Senior Center. The Commission has also partnered with the Stagecoach Museum in putting out biannual Antique Bazaar, where attendees may bring in heirloom antiques for an evaluation or to purchase antiques from vendors at the show. Besides the fundraising efforts, the Commission has put on free fun shows to provide entertainment for the many users of the center. The Commission has also staged games such as Password and the Dating Game that have been successful in providing entertainment to the senior community. More of these shows are in planning. Thank you very much.
Thanks, Harry. Back to you, Commissioner Grimm.
Thank you, Len. We're moving on to item 7, Commissioner comments, special event announcements. Anything from the dais? Nancy?
This year, was not planned, but this year I am doing the outreach for Council on Aging. And Karen, our wonderful person here, has designed a PowerPoint for us, very brief PowerPoint. So if any of you have belonged to organizations, go to churches, whatever, that have meetings, and you would like for us to tell your community, your meeting group, a little bit more about Council on Aging, what they can expect from us, anything we can do for them, please let us know. You can let any of us know or Francine, and we will come. And I'm telling you, it will really be a brief presentation, but you will get to know more about what we actually do for the community, hopefully. So thank you very much, Dave.
Okay. Len?
Thank you very much, David. As a young adult, I was able to graduate from the Berkeley Haas School of Business, supported by War Orphans Act scholarships and 3 summers and many weekends working as a student and a paid intern at Hewlett-Packard in their original plant that had fewer than 200 people. Times have not changed. If anything, a student internship system is more important than ever. Understanding the value of a collaborative that produces student internships, the City of Thousand Oaks, California Lutheran University, and the Greater Conejo Valley Chamber of Commerce have formed a partnership called the Community Internships Training Youth, or CITY. What is needed now is a larger pool of internship sources. If there is anyone here present or anyone watching this program who may know or who can generate an internship for one of these young folk, it would be much appreciated. And would you please contact Francine Spriggle at 805-381-7362. Finally, sadly, a neighbor of mine passed away early yesterday. He was a flying tiger. And I would like to say, Jonelle, children and grandchildren, we're with you.
Very good. Anybody else? Ooh. Oh my gosh, a silent night or afternoon. I just, one thing sort of along with what Len was saying is that as we move into the holiday season, I want all of us to remember that we're neighbors. And Council on Aging is part of your community. We want to know what you're thinking. Please let us know if you have situations in your life, someone else's life, where you need help or you want more direction. You know, we know the resources. We know how to get to the resources to help you. So please keep that in mind, and don't be wary about coming before us to address certain situations that you think should be addressed for the senior community. All right, thank you. That completes item 7 now. And at this point, I'd like to have Roberta introduce our speaker, but as a reminder, questions cannot be taken during this portion of the meeting. This is not a public forum. This is an informational presentation only. If you have questions for the speakers, please hold them until the end of our session when we do adjourn. Roberta, if you would, please.
Thank you, Dave. It is my pleasure to introduce this afternoon Betty Berry, the senior advocate at the Goebel Center. She is one of the people there to go to for any information on Social Security and Medicare. She also writes a column for the Star. She's here today to share changes in Social Security and Medicare. Betty, thank you.
Is that better? Yes. Okay. Good afternoon. I'm back again. I come one year whether you want me or not, right? You have all met Brenda. Brenda is with me in the office. She is another senior advocate at Goebel. And today we have with us Len Euler, who is going to follow my presentation and talk to you about Covered California. But what I'm going to do today is give you a list of what I plan to cover. Then I'm going to try to cover it. And then I hope you don't have any questions. Okay. What I plan to cover today is, why are we having this meeting? And what is the annual open enrollment period? Why supplemental Medigap insurance is not part of this annual open enrollment period? What are these one-stop shops you keep hearing about? What are the senior advantage plans for us in Ventura in the East County for 2014? Do we have to change our Part D prescription drug plans for 2014? And then we're all going to get a form, and I'm going to teach you how to fill out the comparison request if you do want to change your plan. And I'm going to talk about, if you are a low-income senior, you may be getting some kinds of letters in the mail, how important it is to read them and save them. Then any Medicare changes that are coming in 2014. Any Social Security changes, and those two are very small this year. Then I'm going to talk about Medicare and U-Book for 2014. And then I'm going to sit back and turn it over to Len. Okay. But before we get started, we need to gather a little bit of information. You will find Brenda looking around, counting heads and so forth. Every time we do a seminar, we need to collect demographics so that when we go before the various cities to talk about our plan and ask for grant money, they ask us these questions, so we ask you, how else will we get the information? She'll be doing that. And then I just want to go down the list so I know who I'm talking to. I want to determine what type of coverage the attendees have. How many, if anybody, in the audience is here as a brand new member to Medicare? Okay. How many in the audience have a senior advantage plan? Okay, I have some of those. How many have Medicare with a Medigap policy? Okay. How many have Medicare with a retiree supplemental policy? Okay. Is there anybody here who only has straight old Medicare and nothing else? Okay. How many did not sign up for a Part D plan prescription coverage when they should have? When you applied for Medicare to begin with, okay? And did I miss anybody who might have a question later that wasn't addressed by one of these? Okay. Since I have a little bit of everything in the audience, I'm going to try to cover a little bit of everything. Why are we having this meeting? The reason is to alert you to items that you will have to make some changes on or might want to take some action on during this 6-week period that we call the open enrollment. Unfortunately, we are halfway into the period and we still don't have all the fine details. But you don't need them to start planning for 2014. Now, I'm not qualified to talk about the new health care plan. Len will do that. But I can tell you that Covered California does not have anything to do with Medicare. So I had a lady come in, sit down, get all comfortable, and I said, how can I help you? And she said, well, I'm on Medicare, and I want to know how I disenroll so I can enroll in Covered California. That was a very short meeting. I said, it doesn't work that way. Okay. But Len will explain that, and the reason we're including this with the Medicare changes is you come out to find out about the Medicare changes, so you may have family members who need insurance or have just recently lost insurance, and Len can set you on the straight and narrow for that. And then there may be some very unique situations where it will come into plan where you might be covered for California. So he will take care of those. I didn't feel like I needed to be qualified for something else. Okay? Now, we keep talking about what is the annual open enrollment period. Well, it's a period that starts on October 15th and it runs through December 7th. And Brenda and I can't wait till December 8th. This is the busiest time of the year for us. During this time, Medicare beneficiaries have the opportunity to change their basic plans and their Part D coverage. So if you don't like what you have in 2013, now is the time to decide what you want in 2014. What you have is not set in cement, thank goodness. You can change it, but you can only change it once a year. So on December 8th, we are waiting for the first phone call that says, I didn't know the period was over. I hate what I have. Can I change it? And we will smile and say, sorry, next year. You can change from original Medicare to a Senior Advantage plan. You can change from a Senior Advantage plan to original Medicare. Or you can change from a Senior Advantage plan to another Senior Advantage plan. But you have to know what's out there and what's available. You can change your Part D plan. We really and truly hope that you do that every year. Part D plans change, you change. What you have this year might not be good for you next year. It might not even be here next year, so you need to look at that each year. Changes will be made for the coming year, and the choice, as I said, will last for 1 year. The exceptions will be made if you are a low-income senior and you are receiving subsidies. You move out of your area or your plan leaves the area. If that happens, you should seek counseling. We're not trying to build more business, but you can reach us and we will help you. Okay, so much for our open enrollment period. I have had a lot of questions this year about secondary insurance, the Medigap policy. And there is some confusion that this is the open enrollment period, so let's change everything. Well, the open enrollment period does not include changing your Medigap policy. You can change it, but you may be faced with underwriting which would require answers to health care. Purchasing and changing your Medigap policy has its own rules and regulations. You know, it'd be nice if all of these plans went together and we had one period of time when everything worked, but everything has a different period of time in which to do it. Of course, that's good for Brenda and for me because we spread things out. There are times when you can change your Medigap policy with no underwriting. These are called guaranteed right periods. So if you're in one of those periods, you are guaranteed the right to change it with no questions about your health. Outside of these guaranteed right periods, they will look at your health. And my feeling is the insurance companies want you when you're young, well, and rich. The guaranteed right, you can change your policy with no underwriting when you first sign up for Medicare and Part B. At that point in time, you have 6 months following that enrollment period to sign up for a Medigap policy, if that's what you want, with no questions asked. If during the year the plan you have decides to take a holiday and go away, then you have 63 days to change your policy with no questions about your health. And in the state of California, you can change your policy once a year. It has to be in your birthday month. It starts on your actual birth date, and it continues for 30 days thereafter. So in those periods of time, it doesn't matter what kind of health conditions you have, you are guaranteed the right of getting a policy. Other than the guaranteed right periods, you can change your plan at any time. I mean, you have the right to, but you will have to go through underwriting, which could result in not getting a policy. Annual open enrollment is not a guaranteed right period, so if during this period you have to go through underwriting, you may or may not get your coverage. I say that over and over. This is the first year I have had so many questions about changing a secondary insurance. Whenever changing, however, do not give up what you have until you know you've gotten the new one, because we don't want you to be without coverage. Okay, what are one-stop shops? You've heard about them. We had a one-stop shop on October 18th, October 25th, November 1st, and we have one coming up on November 22nd. First, I'm going to say, do you all know what HICAP is? It stands for Health Insurance Counseling Advocacy Program. Brenda, Len, and I are HICAP registered volunteers who have gone through the training, and we can answer the questions that you have. The week during open enrollment is so many seniors need counseling that the individual appointments with counselors are suspended, and many events are planned to centers where counselors are gathered and many more seniors can be taken care of. So I think, Len, you counsel every Wednesday?
Every other Wednesday at Global.
Okay. And Brenda and I counsel whatever day we're in the office. Other counselors are assigned to senior centers, and they're there on a specific day. From October 15th through December 7th, everyone except Brenda and I do no individual counseling. They do their counselings at these larger gatherings. Okay, and these are called one-stop shops. First thing we ask you to do, because we're going to talk about Medicare Part D, as in David, your prescription drug, for these one-stop shops, we ask you to give us a list of your drugs, and we will run a computer comparison of it. Then you'll be given an appointment at a center in your area. You will come, your printouts will be there, and a counselor will be able to counsel you on what would be the best 3 plans for you to select from. We would like to tell you which one is the very best, but we have to give you 3 plans. We can't tell you which one to take. Others may have questions about health care coverage, can be walk-ins without an appointment, and those questions will be addressed on an individual basis. So it will be a one-on-one counseling session. You're not sitting in a group of people hearing all of your particular problems, but you're assigned with a single counselor, and they will address any question you have. The two that are coming up in Simi Valley, the next one will be on Thursday, October 17th, and ours is on no, that's not right. That's not right. There are two one-stop shops. There's one in Simi, and ours is on the 22nd. I have the wrong dates here. But if you have sent in a sheet for comparison, you have probably gotten a phone call back to tell you what time to come, and it will probably be here in Thousand Oaks. If you haven't, then we will see if you want one, and we will get you to fill out a form, and we'll get you squared away. I have here, Simi Valley's is on November 20th, and the Goebels is on Friday, November 22nd. That one on Friday, November 22nd, is the last one that will be here in the eastern part of the county. For the month of December, the 2nd through the 6th, there will be a one-stop shop every day from 8 to 4 at the Area Agency on Aging in Ventura. December 7th, I believe, falls on a Saturday or a Sunday. I'm not sure which, so there will be none. And then on December 8th, it's all over. Okay, some of you have Senior Advantage plans. Does everybody here know what a Senior Advantage plan is? Okay. When you sign up for Medicare, you can sign up for two separate options. You can have plain old Medicare with a secondary insurance and a Part D plan. In this type of thing, it's called Medicare fee for service. You go to the doctor, you get a service, he gets a fee from Medicare. Medicare fee for service. You can go to any doctor that takes Medicare. If you don't have a secondary insurance, then Medicare pays its portion and you're responsible for the rest. The other option you have when you sign up, you could say, no, I don't want original Medicare fee for service. I want a Senior Advantage plan, which could be a PPO or an HMO. With a PPO or an HMO, you do not need any secondary insurance, and you cannot have a standalone Part D plan because your drugs are included in that plan. It's a choice you have. Some people like some things, some like others. The fee-for-service plan allows you the freedom to go to any doctor who takes Medicare. If you wake up some morning and you have a rash on your hands, you don't have to go to a primary doctor and ask for permission to see a dermatologist. On the other hand, if you have Medicare with a supplemental, the supplemental could be rather expensive. If you go with a Senior Advantage plan, a PPO is probably less restrictive than an HMO in that you can go to doctors that are considered in-network. Your copays would be lower than those out-of-network, but your doctor may take that particular plan, so you'd be okay. With an HMO, you must go to the doctors and the providers that they have contracts with, so you're restricted as to who you can see. But monthly, it could be less expensive for you, but over the long run, if you have a lot of things that you have to take care of in 1 year, your copays could add up to be just about as expensive as the other. You're also restricted as to which ones you can have by the area in which you live. In East County, if you want to go on a Senior Advantage plan, you only have one PPO that you can select, and it is Anthem Blue Medicare Preferred Standard. So PPO, that's what you want. You're on Medicare, that's what you're going to get. Is there anybody here from LA County? Okay, because LA County has a bigger choice to pick from. We have 4 HMOs. Correct me if I'm wrong here. We have 4 HMOs. Anthem Blue also has an HMO. It's new this year. It's called Anthem Blue Cross Senior Secure Plan 2. Kaiser Permanente is here and has been for many, many years. SCAN is here, but in Thousand Oaks you might want to question it because it does not have a contract with Los Robles. You would go to the Simi Valley Hospital. And a brand new one that we know nothing about is Humana Gold Plus. So those are the three you have. If you were with an HMO, Aetna Medicare Select last year, you have gotten a letter from them that says we're going on vacation and we will not be available in 2014. So if you got that letter, then you have to pick something new. Okay. I'm so used to saying, are there any questions at this time? Okay. Medicare Part D prescription drug plans for 2014. This seems a long time. Medicare Part D for prescription drugs is the newest portion of Medicare. I can't believe they started in 2006. That's 8 years already. This is the one that you should review your coverage for prescription drug coverage every solitary year. Insurance companies come and go. Insurance company changes the plans they have. They change their formulary, so what might be on their formulary in 2013 may not be on their formulary in 2014. Prices change, whether they have a deductible or not changes. Also, you change. As we go through life, what we take is different. So if you've had changes in your health and your prescription coverage, you might want to look for a new plan. You can either do the computer work yourself, which is kind of difficult to do. However, the population is getting younger and younger, and more are used to using computers, so many more people are doing it themselves. I still find it easier if you give it to us and we have HICAP do it, From this computer comparison, you can determine the best coverage for the least amount of money. Certainly not all the information on file is complete, so while you can or have us run it, we will need to check with the companies you're interested in, and this can all be done at a one-stop shop. Brenda's going to pass out a form for comparison, and we're going to go over it so that if you do need one, you will know what to put on it. This current year, 2013, that we're in, there were 15 insurance companies offering 32 individual plans to select. In 2014, we went down one. There are only 14 insurance companies. One went away. And they are offering about 31 individual plans. Some plans that are not on the list are not selling to new clients. However, they are still in the business of continuing to serve those who are already enrolled. Anybody here have SilverScript as an insurance plan? Okay, you got a letter. Okay. SilverScript is one that you can still keep SilverScript if it works for you. They will still serve you, they'll be grandfathered, but they can't sell to new people because they were bad boys and they're being punished. Okay? And Smart D was a new one last year. I don't know if everybody had Smart D. Evidently, it did not work out too well because they decided to leave the county. So let's look at the form you've got. Oh, God. Brenda, give me a form because guess what I don't have? Oh, yes, I do. Yes, I do. I'm sorry. I do have it. That's all right. Filling out a form sounds like it's an easy thing to do. Evidently, that's not a true statement. When we get these forms in, Brenda and I look them over before we send them up north to have them done, to see that you've got the right information on here. Because when it gets to Ventura, if they can't read it for some reason, they call us and say, what are they taking? I've gone over these forms with other people, and sometimes they listen, and sometimes they don't. So, on the first part of the page, which has 3 squares on it, the first square wants your name. And it has to be the name that is on your Medicare card. If your name is Dorothy, but everybody calls you Dot, I don't want to see Dot on the line. It's just that simple. Home address, I don't think there's too many questions there. Mailing address, city, zip code, and your phones. There's a section down here that says birth date and Medicare number. You can just draw a line through those. The young lady who heads up HICAP really needs those if there is a problem with your form or if you call later and you have a question. But for just doing the comparisons, you really don't need to give up your birth date or your Medicare number. And I don't know how many of you may have gone to one of my seminars where I talk about identity theft and I say never give out these numbers. Okay? So don't do that. The date of Part A and Part B are on your Medicare card. And then do you currently have a Part D plan? Either yes or no. I have had a yes there, and then what is the name is the next question, and there's no name. I've had no, I don't have one, and then they give me a name. So if it's yes, then follow it with the name. So we're into the second box now. Do you receive prescription drug coverage from a retiree or employer plan? If you do, check yes. And that is a completely different type of plan than a Medigap policy. Are you entitled to veterans benefits? If you are a veteran or if your spouse was a veteran, we need to know that because we will look into that then to see if there's a way to get you coverage under the veterans plan. What is the name of your current prescription drug plan? A yes needs an answer there, a no does not. And then please indicate if you are currently in one of the following Medicare Advantage plans. Do you have Kaiser or Secure Horizons or SCAN or Aetna, Anthem Blue, Blue Shield, or Physician's Choice? Those are the Senior Advantage plans. If you have one of those and you check it, they will check that coverage for 2014 to see what the plans associated with that particular company will be for you. And then the last column, you may be eligible to save money on prescription drug costs. We can help you do this. We ask a few personal questions here. What is your gross monthly income? If married, total income. I'd like to meet the man who filled one of these out. His monthly income was $74,000. Somehow, I think he didn't see the word monthly. Are you receiving extra help for prescription drug coverage? You know whether you are or whether you are not. Then there is a question, is your monthly income less or more than, and they give you an individual, a figure for individuals and one for married. And do you have assets more than, and they give you two figures. If you meet those qualifications, you will likely be entitled to assistance with your drug program. And so then when this plan gets worked, they will determine what kind of coverage you can have and what the help will be. Okay, at the very bottom, where does the completed comparison go? If you don't want to be counseled, you can have it come back to you and you can look at all the stuff yourself. But I think if you've gone to the trouble to fill out the form, you might want to be counseled. Then in some cases, a counselor, Brenda and I may have certain people that we work with all year and we say, we'll have it come back to us, we'll counsel you separately. So that way you would have it go back to the counselor, or you want it to go back to the one-stop shop and you will be assigned a date. Okay? That doesn't sound too difficult, does it? I wish you could see the forms we've gotten this year. The other thing is, I'm going to take this form and I'm going to fax it to Ventura. So I need two things. I need it written so I can read it, and I need it written dark enough so when I fax it, they can read it when they get it on the other end. If we turn it over, this part seems to confuse people a little bit. In order for us to run this, we need to know something about your drugs. So I need to know the name of the drug you're taking. Now there's generics and there's brands. I don't want the brand name if you're taking the generic, nor do I want the generic name if you're taking the brand. So what's the name on the bottle you're taking the pill out of? That would be a clue. Dosage, what is the size of the doses? How many milligrams, whatever. And then how often do you take it? 2 per day, 1 per day, or so on. The columns are here for a reason. They make it very easy for the computer person to pick up the information that they need to key in. I have seen these written in such ways I don't know how. I'm going to give them all a trophy for getting these through. I really am. After you have done that, I'd like you to read the disclosure statement and then sign it and date it. I had 2 left on my desk last week, which were filled in on this side. There was no information on that side. I just think people are in a hurry. Take a little time, because if we can't read it, we cannot process it. Okay? Okay, where am I on my list? Okay. You may, did the next one letters? Yes. You may get some letters in the mail, particularly for anybody who might be a low-income senior. You will get letters from various associations talking to you about this. Most people will take these letters and say they're junk mail and throw them away. They may say you qualified last year for this program, but you don't qualify this year unless you do the following. But they don't read it and throw it away, and then the next letter they get it says, you are denied that benefit. And they say, oh, I didn't know I should have done something. Please, if you get a letter from Medicare or Social Security or Medi-Cal, at least open it and read it and see what it says. It is not all junk mail. And then you should retain the letters so that if you have to come in to see one of us, you can bring the letters with you and we can read them. Many times, I think Brenda will agree with this, we get a question on the phone and it says, I got a letter that I don't understand. Okay? I'll read it to you. Okay? Please don't. But they go ahead, well, I'm not going to read the first paragraph to you because that's not important. And the second paragraph, well, let's see. Well, what they're really saying is this. I don't get the actual paragraph. And I have no idea what the letter says. So I'd rather you not read me the letter. I'd rather you make an appointment to come in with the letter. And then sometimes when we read them the first time, we don't understand them either. We sit down and we read them out loud so that we can get them. I think Social Security has a special class to train people on how not to write a letter because they're most confusing. So sometimes when you sit down and read them together, it makes more sense. These letters are not necessarily the clearest things in the world. Medicare doesn't have many changes this year. I don't think there's much there to change, really. What you will probably see is an increase in your Medicare Part B premium. We did, you all have read this, I'm sure, we did get a raise in Social Security, a 1.5% raise, which will equate at average $17 to $19. Well, it's better than we got 2 years ago because we got nothing. But when you get a raise in Social Security, your Medicare premium will go up. Usually goes up about $5 or $6, so I am figuring that the $104.50, which is the base this year, might go up to $110. You can look forward to that, but they haven't announced it yet. Also on Medicare Part B, you have an annual deductible that Medicare approves but doesn't pay the first this year, $147. That will likely go up a few dollars too. So out of your $19, you probably make enough maybe to go to lunch. Social Security, it was the 1.5 that we got, and there's nothing else really to change about Social Security. In the next few years, or that MedChat program that Brenda was talking about before, in the future there may be some changes here to both these programs. We can look forward to that. Now, how many of you got this book in the mail? Okay, keep your hands up. How many have not read it? Thank you for reading. This book is full of all kinds of information. What it doesn't have in it is numbers, like what your increase is and so forth, because this book was probably put together in July and they had no idea. But this book is just full of information. I would like you all to come in and see me, but the answer might be right in this book. Or you could read something in this book that you don't quite understand, and you can come in and ask about it before it might happen to you, and you find yourself in the middle of nowhere. So I've noticed that even Dancing with the Stars on television isn't good this year, so you might just, instead of watching television, you might go ahead and read this book. Okay? Okay, I think, there's not a lot of changes in Medicare this year. It's mostly Medicare Part D. So, Len, I'm going to give you the microphone.
Thank you. Hello, my name is Len Euler. I'm a volunteer for the Health Insurance Advocacy Program. Our program is administered by the County of Ventura. We have a small paid staff and 30 or so volunteers like myself. We provide unbiased counseling to Medicare recipients and those that will soon be receiving Medicare. And this is what Brenda and Betty do for many, many years and do a great job. Covered California, well, the act I'm talking about today is called the Affordable Care Act of 2010. The goal of that is to provide affordable care and eliminate pre-existing conditions. Covered California is basically California's administrator of the Affordable Care Act. I believe half the states chose to set up an exchange run by their particular states. The states that did not want to participate, the federal government filled that void, and that is being run by the federal exchange. But Covered California is not the name of specifically the program. The act is the Affordable Care Act, but Covered California is what is administering the act for California. Covered California has a large responsibility and a large job to educate everyone and to sign them up in a timely manner. I'm a certified educator, and basically what we do is they came to us, we spend 2.5 days in training, we have a book probably as big as a phone book that we have to read, and then we have to take a test. And if you don't get at least 80, you will not be an educator. I believe you get two chances. I think I got a 92. The next step is to be a certified enrollment counselor. I'm an educator, I'm not a counselor. What's important about that, not an enrollment counselor, what's important about that is I can't really give you specific information for your children, for what you should do, how best to implement the plan for yourself. So we're not going to do that today. I am waiting to receive that certificate. It's just a matter of anything else. They're training so many people, and there are a lot of trained people out there. It's just that I don't have that certificate yet. My goal today, then, is to explain the elements of the Affordable Care Act, not to debate its merits or its implementation. The changes for 2014 is that the Affordable Care Act provides affordable coverage to individuals without credible coverage. Affordability is considered as not having more than 9.5% of your monthly income go towards your insurance premium. This act is not designed for individuals on Medicare, Medi-Cal, or if you have credible, affordable coverage at work. A lot of people on Medicare, my mom included, and as Betty mentioned, they want to get this because they think they're missing out on something. And I think for myself, if I was an individual, based on my income, I would pay about $300 for a Kaiser plan. And I'm 60. And when I'm 65, I would pay for the exact same plan, nothing. So I tell my mother that her Kaiser plan costs her nothing, and it's costing me $300. She's not missing anything. So
people on Medicare have a very good insurance, and they believe me, they're not missing anything by not being on Covered California. The other thing, when I say that's affordable, credible coverage basically is if your employer offers basic coverage that's less than 10%, actually 9.5% of your gross monthly income, you're able to join Covered California because they're not offering a credible, affordable plan. Medi-Cal has now been expanded to individuals making less than $15,857 and households up to five people that make less than $38,047. The biggest change with Medi-Cal is that there's no asset limit, and that is huge because we counsel people that are in Medicare and Medi-Cal both because they don't have a lot of income, but until they basically spend down all their money to $3,000, they cannot get Medi-Cal help. That's no longer the case. So that is quite huge. Insurers can no longer penalize an individual for having a pre-existing condition. This act provides for small businesses to shop for insurance on the exchanges, and also some businesses may receive a tax credit. The other significant changes in insurance is that mostly preventive care should be free, guaranteed availability of coverage. There are no annual life or there's no annual limits on the amount that you can claim under your insurance. A lot of times plans may have $1 million limit. If you have a serious cancer that you can easily eat through that, then you have no insurance. There are penalties for no coverage. The first year, it's 1% or $95. That's 1% of your income, whatever is higher. That's the penalty the first year if you have no insurance at all. And again, if you have Medicare and Medi-Cal, you have insurance. Now, one of the things it did too was when it standardized plans that insurance companies couldn't offer these plans where people thought they had insurance, and when it came to use them, it really didn't cover anything. I believe 3/4 of the people that went bankrupt for medical reasons had insurance, but they went bankrupt because the insurance didn't pay anything. Also, I believe more than 50% of the plans do not cover maternity care. And so what they wanted to do with this act is have 10 essential ingredients within the plan. So in Ventura County, there are 3 providers, and we'll get back to that in a second. But basically, it's Blue Cross, Blue Shield, and Kaiser. They are all what we call managed care plans. So you do have a restriction to abide by their rules and go to their doctors, either go to their network, or if you go out of their network, you have a higher pay. But if you participate in the Affordable Care Plan, those are the providers. They can change every year, but this year in Ventura County, those are the 3 providers. Going back to the 10 essential items that each plan must offer are ambulatory care, emergency services, hospitalization. There are many plans out there today that do not cover hospitalization, which would bankrupt you after probably 3 days. Maternity and newborn care, mental health and substance abuse disorder treatment, prescription drugs, rehab services, lab services, preventive and wellness services and chronic disease support, and children's services, including dental and vision care. And as I said, all 3 of these providers have to provide these plans. What's a little tricky about the plans, and this is why I encourage you to go to a certified investment enrollment agent, is picking your deductible. There are 4 plans. And if you go on the website, there's a cute little bar graph like this. And in essence, what it does, and they're called metal tiers: bronze, silver, gold, and platinum. And most people know that platinum probably costs a lot more than bronze. and that's how these plans work, too. Now, they give like a general ballpark information. I'll give you an example, but to really figure it out, you have to sit down with your provider and kind of look at what's your experience. How often do you go to the doctor? How often do you go to the hospital? Do you have any large procedures planned in the next year? So everything's very personal, and that's how you decide. Well, do I want to? Well, for example, I'm going to just throw out some numbers. It's easier for me to do this. For someone like me, and I'm 60, to get a silver plan after all of my subsidies is about $4,500 a year for two people. Okay, if I want to move up to the platinum plan, it's $10,000 a year. Okay, so basically, I have to get $5,500 of benefit out of that plan. And if I were to use, let's say, $20,000 of costs, and my copay is 20% more in my silver plan, I'd have to pay $4,000 more out of pocket, but I've saved $5,000 by staying in the silver plan, so break even is to be in the silver plan. However, if my out-of-pocket is a lot higher, it might make sense to be in a platinum plan. So it's all personal decision-making and a little bit of risk. You're taking a chance. You might only have used so much care last year, and God forbid you get in a car accident and you guessed wrong. But that's what you need to talk to your insurance provider about. And when I talk about copays, again, they break it down as 10, 20, 30, 40. 10% being the platinum is what you're going to copay. The lowest is bronze, it's 40%. The other, though, important aspect of those is that the out-of-pocket for the year, again, the idea of this program is you don't go bankrupt when you go to the hospital. Basically, for an individual, the most out-of-pocket you can pay is $6,350 a year. No matter if your bills were $1 million, that's it. Okay. For a family, it's $12,700. The only difference is in the platinum plan, your out-of-pocket is $4,000. So again, you have to wiggle that with the $10,000 you're paying in premium versus possible only $4,000. Let's say worst case, you pay $10,000 premium and $4,000 out of your pocket, you paid $14,000, and you just have to judge that against what could happen in your other plans. Okay, another example. A lot of people hear my plan's going up from 200 to 400, and I know I'm getting more coverage, but I can't afford it. Well, going back to the affordability, and here's a good example. Again, I'll give you an example for a 60-year-old and a 30-year-old, because we're not going to use every age, obviously. Let's say a family that's two 60-year-olds, okay? $48,000. And by the way, to get a rebate or a subsidy for a family of two, you have to make between $21,000 and $62,000. This is gross income. If you make under $21,000, you're eligible for Medi-Cal. Okay. If you're in the $21,000 to $62,000, there's a sliding scale on how much benefits you receive, and it's quite substantial. Okay, here's and then if you make, again, over $62,000, 040 family of two, you can still buy these programs, but you just don't get the subsidy. For example, so for a family of two, $48,000, the first thing they see is the rack price, and a lot of times on these news programs, they just tell you, oh, my insurance is going. Well, anyway, the rack price for that is $1,400. Okay, so for two, $1,400 is a hell of a lot of money. The rebate for that family is $1,000 a month, and this is what people don't realize. Okay, so their out of pocket is $380. Okay, now and the way you kind of can back into that, if you're in this range, is for this family making $48,000, if I did my math correctly, and their monthly premium is $380, that's 9.5% of their income. And basically, that's how the program works. If you're in the 21 to 64 bucket for a family of two, the affordable care means you can't pay more than 9.5. So no matter what the insurance company charges, you will get a rebate from the government so that net to you, it's 9.5%. So that, again, it's $380 for a family of two instead of $1,400. It's quite substantial. Now, I guess, if you're making $80,000, you just have to pay the $1,400. You get the same plan, but you're not going to get the rebate. And this is how the program is set up. What's very, very important is that the way this rebate works, and it's very, very tricky, you have to, when you sign up, you have to tell, well, when you sign up, you have to tell them, basically, have a crystal ball, and tell them what you're going to make next year. It has nothing to do with what you made this year, except if you're going to make exactly the same. Okay, so let's say, go back to this family, $48,000, $1,000 credit. The government doesn't make you wait till the end of the year because you don't have $1,000 to pay, and the insurance company wants their bill January 1st or January 1st. So the government kind of takes you on your word that I'm going to only make $48,000. And you stick by that. Okay, the government will send $1,000 to the insurance company on January 1st, and you will get a bill for $380. It'll show $1,397 less $1,000, and all you see is $380, and that's all you have to pay. And that works really good. It works all year. Well, at the end of the year, let's say you got some raises or won some money, and your income goes from $48,000 to $52,000. Well, the government's going to refigure that and say, you know what? Based on 52, you shouldn't have got $1,000 a month. You should only got $800 a month. So they're going to come back to you 200 times 12, $2,400. They're going to add to your tax bill, and you don't want to see that surprise. What I'm going to do personally with mine, I don't have $1,000 credit, but let's say I had $800. I might have the government put $500 to my insurance company just in case my income goes up. Worst case comes to worst, if my income stays the same, that $300 times 12 I get back as a refund. It's a credit. You don't lose it. So I'd advise people to, if they can afford to, pay on the high side. The second way to protect yourself is any month you get a raise at work or something changes in your income. If you call Covered California on January 31st, I believe by March 1st at the latest, they will change your subsidy. So definitely do that if you see income going up. They really are going to be unhappy with people that game the system and knew they were going to make a lot more and took all this subsidy. You will owe the money, and they will come back after you. So you have to be very careful in taking the subsidy. Okay. Lastly, how to enroll. I got to say, I like to, I talk with you and I tell you how to do things, but I like to do it myself to see if it works. I think the first week in October, I called Covered California over the phone, and they said the holding time was 5 minutes, and they answered in 3. I was pleased. And very, very pleasant people there. I said I wanted to know what the cost of the plan was. There's a calculator right on the website. It works fantastic. I said I wanted an agent in my area. I want to find someone to sit down and talk to. Well, they have a website for that, too. And you put your zip code in and how many miles from your house, and I did that, and nobody was there. So I called them back. And they said, well, basically, we're training people, just like I'm being trained, okay? So I did the search. Instead of 5 miles, I did 10 miles. And there was one person. So they probably got a lot of work. So what I did now, I did it this morning. I called again, and the tape said not 5 minutes, but 20 minutes. 20-minute wait. And they came in about 12 minutes. It wasn't horrible. And I talked to them for a while, and they said, things have gotten a lot better. So I went onto the site, and I clicked on agent by zip code in Thousand Oaks, and there were 80. So it went from none to 80. So they've really got that backlog done. And then I did within 10 miles from my house, and it was 148. So what I did, again, just as a consumer to see how this works, right? I called the first two on the list. And I don't understand why. They're not in alphabetical order. Right? There's no rhyme or reason. Maybe they're the closest to my house. I don't know. It doesn't say. But anyway, I called the first two. They didn't answer the phone. The third one, very pleasant, and he would love my company. I love my business. And he just told me what to do, and I can make an appointment with them. And so all I'm saying is there are a lot of agents out there. So these agents basically are insurance brokers that are licensed, that sell all kinds of insurance. However, you might have an insurance broker that sells you insurance for your home. If they do not take the exact course the course I'm going to take, they are not certified. If they're not certified, they can't sell you this, and you can't get a rebate. You have to go through Covered California to get a rebate, and you have to deal with a certified agent. So it's very important. We'll talk more about that. Besides certified agent, what they're doing too, I think they get $68 a head for signing you up. But also, they're building a rapport with you. Then they can sell everything else to you. So they want to see you. The other people that you can go to are agencies like ours. Some other agencies might have their license to sign you up. We don't have ours at HICAP yet, but you can check with us back later. Okay, so that's okay. You can basically apply online. Go and fill out everything by yourself, but that's pretty hard to do. I'd advise using an enrollment counselor. You could click and get an agent, or you can call Covered California and ask to have someone contact you. I prefer you contact them because people contacting you, you're not sure who they are. However, if someone contacts you or if you're not sure, get the person's name and certificate number. You can go to Covered California, put their name and license number in, and it'll show if they're legitimate, okay? And then if I saw them after that, I'd even want to see their ID to make sure they're the ones that are that person. You really have to protect yourself. You can also apply by mail, or you can apply by phone, where you just call Covered California, and I believe they'll walk you through it. Never provide your Social Security number or other delicate information until you have verified you're dealing with a registered agent. And that's about all I have. When I'm done today, I have a one-page sheet that gives you the website and phone number of Covered California. If you fall into the income bracket that you qualify for Medi-Cal, that's being administered by the Ventura County Human Services Agency, and their phone number and website are provided also. I believe even though Medi-Cal is offered by a different agency, Covered California may be able to assist you. You'll have to talk to them, because a lot of people, they could flip-flop between these two agencies based on their income. So if you're not sure about your income, you could always go to Covered California first and see what they recommend. So that's the general information. And again, there are ways for you to get a certified investment enrollment counselor, and that's the next step, really, is to see a certified enrollment counselor. Or go on the website and educate yourself. It's a great, great website. And a lot of it's working now. Thank you very much.
Thank you,
Sure.
Betty and Len, very much.
I'd like to just, excuse me. I'd like to add one thing.
Please.
If anybody in the audience wants us to run their drugs for them, complete the form. Do not send it to the address on the back, but get it over to the Goebel Center, to Brenda or myself. We will make sure it gets there and that it gets done, and then you will get an appointment for the 22nd. If you have any other questions, you can call Brenda or myself, and we will try to assist you. And I'm sure you'll answer any questions about Covered California. Thank you.
All right, are any questions from the commissioners up here, anything like that? Yes. Nance, go ahead.
Betty, so if you, in people wanting to switch, if you have a Medicare Advantage presently, you can switch to another Medicare Advantage plan.
That's correct.
Okay, and if you have a Medicare Advantage plan now, you can switch back to regular Medicare, original Medicare, fee-for-service, and still get a Plan B to go with it? I mean, you can do...
Okay, if you currently are on a Senior Advantage plan, and you've been on it for more than a year, and you want to come back to straight Medicare, you can do that. You can buy a Part D plan to cover your prescriptions. You can apply for a Medigap policy, but there may be questions about your health.
Okay, so it's not an automatic that
That's
you
right.
can make that switch and get the Part B
Right.
plan. Okay, thank you very much.
I understand there are some effects of the Affordable Care Act on Medicare, one of which is to phase out the donut hole that we all know and hate.
The donut hole is getting smaller each year. You remember when we started in 2006, you paid full price for that drug. Several years later, we conned the pharmaceutical companies to pay for half, so you were paying 50%. Last year, Medicare agreed to pay 2.5%, so you were paying 47.5%. Different with generics, but it is coming down. By 2020, the gap should cost you only 25% of the drug.
Okay. The other change that I've heard about was that Medicare subsidizes the Medicare Advantage plans,
That's
and I
right.
understand the subsidy is about 17% of what it costs to insure somebody directly, and I understand that will disappear. Have you have any sense for what the reaction of those companies that are providing Medicare Advantage plans is going to be?
The Medicare came in 1965. It wasn't until 1985 that we were given the choice for fee-for-service or senior advantage plan. And the government decided to do that so you had an option, and also they figured it was the least expensive way to go, which didn't turn out that way. They do pay, those companies, a set amount each month for each person. I believe this year, 2014, that will be reduced. It is not going to reduce anything that goes to the patient, because along with that reduction is the rule that 85% of the money that you get must be spent on client care. It cannot be spent on administration. In the future, yes, what I understand is they plan to bring that down so that in Medicare fee-for-service, where we have an 80-20 split, and it costs the customer 20%, they're going to have them equal, so they'll cost about the same. Haven't heard any complaints yet, but it hasn't really happened yet. I'll see you next year.
Betty, when I don't know how many people change their insurance coverage, but going through that kind of change would be kind of dramatic, I would think. And you mentioned that you don't, or you'd want to know if when your policy comes into effect from the older coverage.
Oh,
I mean, how are you very assured that you have the new coverage?
Okay, basically changing from a senior advantage plan to Medicare only requires purchasing a Part D plan for prescription drug coverage. Because if you buy a standalone Part D plan, you've just disenrolled yourself from your plan. But you automatically go back on Medicare.
Okay.
But if I was going to do that, like you suggested, Nancy, I would search the Medigap policies first and see if I was covered. And then, knowing I want to do it on January 1st, I would ask them to cover me as of January 1st. If you have a senior advantage plan, it's against the law to sell you a Medigap policy. But if you are doing it in hopes of changing back to Medicare, you can do that.
I see. Okay.
But always make sure you got the new one before you let the old one go.
A question on Covered California. You're saying that we really should contact Covered California as opposed to going to an insurance agent at this point.
Well, I said a few different things. One of the ways to get a certified agent is through the Covered California site.
True.
That they're listed, so you don't have to go in the phone book and dial around. If you have an agent that sells you home or car insurance, you can call him and ask if he's a certified agent, and if he is, you can go to him. I was saying the site is beneficial to the extent of the agents are listed that are certified on the site in your area.
Another question. If a person has employer coverage,
Right.
how does he discern what he needs to come up to a covered California status?
Right. I believe what you're saying is how does he know if his insurance at work disqualifies him for covered California or not? Basically, my understanding is if you, I don't know if Covered California has all the insurer plans in their database. They may, but they would be able to tell you, based on your coverage, if that is credible, affordable coverage. So they make that determination. In other words, and let's say you just went to apply with them. They will ask you if you're working, and they'll want to see your coverage because they'll see if you have credible, affordable coverage, they will not take you. But if you don't, they will.
Okay.
So they make that decision.
Okay. Wow. Any other thoughts, folks, up here? Very good. Well, this is, as always, Betty, you bring forth so much information, and it's so wonderful to have you in our community to help. And I discovered California. Some of the best explanation I've heard of it.
Oh, thank you.
And I do thank you.
At HICAP, we try to be unbiased, but just like with Medicare, we really are happy for Medicare people. It's there, you know.
Yeah,
but we're unbiased to the extent of what insurance company you should use, or that's your choice.
Yep.
Right. Thank
All
you.
right. And again, folks, once we adjourn, we'll certainly, please, have and learn more about it.
Are you ready to
All right. Anything else here? All right. I guess before we adjourn, just a couple of reminders. I know Brenda brought up a point about the boomers. The boomers, it's something that we've all been trying to understand who and what they are and what they want to be when they finally grow up. Well, this is an opportunity. If you don't attend, please let some of your siblings or your not your siblings, but your children know that this is something that they should be thinking about. So I encourage everybody to come to the Boomer Boot Camp tonight and for the subsequent Wednesdays. I have a fraternity brother back in Iowa who is doing things like Betty does, and I invited him to come on the text or to see our streaming show, and I hope that maybe he's got some insight on that. So, Brother Mitch, carry on, my friend. Let's see. If you would like any information about the Council on Aging or have questions about the agenda items discussed, please call 805-381-7362 or email councilonaging@tooaks.org. All right. There being no further business, we'll adjourn this meeting until we meet you all again December 4th.